You are listening to part 82 of our series, 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Thank you, Gemini. I hope you went home and, feeling like, wow, there's a whole lot of appointments that I don't have to make now.
Exactly.
Exactly, right.
And tell my family members.
And tell your family, I mean, because these things are really widely overused. So we started talking about the problems with screening tests specifically last week. And I wanted to continue with that because there's a lot of people out there who are putting out information to help us. And I ended last week by thanking those people that were not just alone out there, in the high technology maze, but that there are a lot of people offering us ways to stay safe when we do this. And one of the people that I mentioned last week as part of the Choosing Wisely campaign was Reed Blackwelder. And Reed Blackwelder also has an article that he's written about tests. So I wanted to go into a little more detail with that. He suggests that we ask ourselves if we are getting cookie cutter care. In other words, is our doctor telling us to get a test because our doctor thinks we need a test, or because everybody is supposed to have this test? Too many people, says Reed Blackwelder, president of the American Academy of Family Physicians. Far too many people are being given tests and procedures that have nothing to do with their specific health situation. And there is more and more evidence, he says, that these tests are causing more harm than good. And he suggests that you visit their website, thechoosingwisely.org. It has information on a whole range of tests and procedures, including the 10 that we went over last week and the ones here in Reed Blackwelder's article. He reiterates that scans for low back pain are not going to help you at all. The doses of radiation from X-ray and CT scans on back problems are not worth it. The radiation is going to cause more harm than any information you can get. And worse yet, these kinds of scans and X-rays sometimes turn up other problems that wouldn't have necessarily needed any attention, but they now trigger this attention. Remember last week, I told you that studies are finding when we take X number of people with back pain and we go out on the street and we look for the matches, right? So we have 80 people with back pain, and one of them is this age and has this much education, and so on and so forth, and we find somebody without back pain who matches them, and then we do a scan or an X-ray of their back. The people without back pain are just as likely to have abnormalities in their X-rays and their scans. So fixing it in the people with pain doesn't necessarily fix the pain. This, again, is one of those those things that we're told, well, you get this test, and then we'll be able to do something to fix you. But that is not so often true as we would like to believe. Unless you are experiencing worsening nerve damage, which would be loss of bladder control, loss of bowel control, loss of sensation in your legs, loss of muscle power in your legs, or have cancer which might have spread to your spine, you don't need an imaging test. Your back pain is going to go away, and it will go away faster if you don't do surgery. There is no medical or legal reason to get any x-rays as a baseline for comparison for work-related back injury. What I'm understanding that Reed Blackwelder is saying here is that if you're in a profession where a lot of people get back injuries and you think you might get a back injury, and you say, hey, let me get an x-ray just to establish what my back looks like, as opposed to what it might look like after an injury, there is no legal reason to do that, and there is no medical reason to do that. All right, from the back to the bones. For years, decades, physicians have been routinely recommending bone density tests using dual energy X-ray absorptiometry, DXA. This test estimates the amount of bone in the hip and spine as a marker for osteoporosis. Until recently, women have been advised to have a baseline DXA scanning at menopause and then periodically. However, being labeled with pre-osteoporosis or osteopenia will start you on a medical journey of repeated DXA testing and use of medications that will be harmful to you. I'm not going to reiterate the problems with the drugs. There are problems with those drugs. And I do want to quote what Dr. Blackwelder is saying here. He says, evidence shows that a bone density scan is not a reliable predictor of fractures even in high-risk patients who are already receiving drug therapy for osteoporosis. The latest thinking is that unless you have a special risk factor, such as a family history of osteoporosis, personal history of smoking or alcohol abuse or use of corticosteroid drugs, then, and you are a woman under the age of 65 or a man under the age of 70, then you don't need a DXA screening. Now, if your DXA test results show normal results, then you do not need to be tested again for 10 years, so long as you do not lose more than 1 inch in height over that time period. Again, many people are quite shocked by these things because it's part, they go to the doctor. They don't go to the doctor every year. And when they go to the doctor every year, they have these screening tests. And so they think of them as yearly things. And I sometimes find it surprising that people who are a little edgy about dental x-rays expose themselves to more radiation in many of these tests, simply because they think they have to do them in order to prevent any future problems. Have you heard people thinking that these tests, these screening tests, are preventative?
Oh, sure. Yeah, almost everyone I know thinks of them as being preventative, but in my family anyway.
Well, as we can see, these tests don't prevent anything, but they do often trigger treatment that can harm us and that might not be useful. Carotid artery imaging. The carotid arteries carry blood from the heart through the neck to the brain. If they become narrow from a buildup of plaque, which is known as carotid artery stenosis, then the blood flow to the brain is slowed down, and your risk of stroke increases. And I would guess that maybe your risk of dementia increases too, because your brain isn't getting as much as it should. Doctors can use ultrasound, magnetic resonance angiography, and MRA, or computed tomography angiography, a CTA, to check for plaque in these arteries. And if the testing does show a blockage, you are going to be advised to take medication that has never been shown to increase lifespan. I found that rather startling, that there would be a test, and the test would say you have this problem. Here's the medication for the problem, but the medication doesn't cure the problem, and it doesn't improve either the quality or the quantity of your life. But again, if you're going to the doctor every year and the doctor is simply suggesting these tests, most people go along with it. So it's one of the reasons I'm spending some time raising the red flag here, again, so that we can tell our families and our friends that they can go to the choosingwisely.org website and check out what is going on about whether or not they really need these tests, right? If the testing, the carotid artery imaging shows a blockage, you may even be urged to undergo surgery, which is called an arterectomy, to clear the artery. But this is a very difficult and complex operation, and it can, like any operation, lead to stroke, heart attack, or death. Wait a second. I thought we were doing this to make people healthier. Again, remember, we're doing this in non-symptomatic people. Unless you are experiencing symptoms such as transient ischemic attacks called mini strokes, unexplainable dizziness, don't get screened for carotid artery stenosis. Evidence shows that the harms of screening and subsequent treatment outweigh the benefits. If you do undergo screening for carotid artery stenosis, say no to surgery unless you have more than 70% blockage in one or both of those arteries, and you have had a stroke or mini stroke in the previous 6 months. EKGs and other stress tests. During routine physicals, doctors often order electrocardiograms, EKGs or ECGs to measure the heart's electrical activity, and cardiac stress tests to check the same functions while you're stressed by exercise or medication. But unnecessary stress testing leads to false positives, indicating that something is wrong when really you are healthy. That means more follow-up tests, including CT scans, coronary angiography, both of which expose you to lots of radiation, and in some cases, an angiography leads to a heart attack while the person's having the test. If you have a bad EKG or stress test, the doctor may prescribe heart medications for you without discussing lifestyle changes that could be used. Certainly, there are reasons to have these tests. We are not saying that the tests are bad or that they should never be used. What we are saying is what we've been saying about drugs. They're overused. And your first answer usually should be no. The wonderful newsletter, Health After 50, which it comes through Scientific American, also looked at this issue, but especially looking at diagnostic health tests and trying to discern if they can actually harm your health. Concerns about radiation and over-testing have prompted medical societies to update their advice. Experts say too many people are undergoing these tests as part of routine risk assessments, and they have negative impacts on patients. They have a low but definite percentage of false positives, suggesting a problem when there isn't one, and they cause patient anxiety, which depresses the immune system. Plus, they almost always lead to further unnecessary testing. Radiation risks with cardiac imaging, says the American Heart Association in a scientific statement published in Circulation magazine, are not to be underestimated. Has your doctor clearly explained to you the reason they want you to have a cardiac imaging CT? All right? With drugs that contain radioactive materials and X-ray imaging and real-time, has the doctor really explained to you the actual risk of doing this procedure, and what are the risks if you say no? Certainly no one would want to overstate the risk of low-dose radiation, but it is important to understand that cumulative radiation exposure is linked to cancer and cell damage, which can take decades to appear. Tests employing fluoroscopy, which is X-ray imaging in real time, can cause radiation-induced skin injury. Large doses of radiation, whether at one time or accumulated dose by dose from screening and other tests, do have significant consequences, says James L. Weiss, MD, professor of cardiology and director of the Heart Station at Johns Hopkins University School of Medicine in Baltimore, Maryland. Evidence linking cancer to small amounts of radiation, such as one CT scan or one nuclear medicine scan, they're very limited. But experts agree it is wise to avoid unnecessary exposure. Even though the radiation risk from a single test or even a few tests is small, the risks really must be taken into account. If the test is not really necessary, no amount of radiation risk is acceptable. Another cause for concern is the use of these tests on healthy patients who have no symptoms. The American College of Physicians recommends against routine cardiac screening for low-risk adults. They have found no evidence that routine screening benefits low-risk patients or improves the outcomes. In fact, needless EKGs, echocardiograms, and nuclear stress tests cause undue anxiety, invasive tests, procedures that are both expensive and directly harmful to the person. Now, it's kind of rare, 1 in 10,000, but there are people who actually had a heart attack as a result of a stress test. If your doctor's prescribing routine screening for you, ask yourself, does cookie-cutter medicine really suit you? So, Scientific American and Consumer Reports has put together a little list for you. Ask for information about any test that a doctor says you should have. And here are some questions to ask. 1, will this test help diagnose or treat my problem? 2, what are the consequences of not getting this test? 3, is there another safer test that can be used that will obtain the same information? 4, if this test uses radiation have you reviewed my radiation exposure history? If you've had frequent imaging tests or changed healthcare providers, this turns out to be a very important question. 5, if you've had previous tests, ask if those test results can be used in this situation without redoing the tests. 6, if radiation is involved, how much radiation is involved, and we are advised not to settle for not much. Don't worry, it's not a concern. We're actually asking for how many millisieverts of radiation are we getting from a particular test. 7, will the radiation dose be specifically adjusted for me during this test? People of different body sizes, heart sizes, weights, and ages respond to radiation differently. If the facility that you're going to or the practitioner that you're using uses the same radiation dose for all patients, I quote, find another facility or practitioner. Scientific American and Consumer Report says the radiation dose for any test using radiation should be adjusted for your height, weight, age, and heart size. 8, how is the radiation in this test going to affect my risk of developing cancer? Now, this is a bit of a difficult question. They admit that it's, in fact, a question that's almost impossible to answer. However, because it takes decades for cancer to develop, older adults are actually less likely to get cancer from radiation. The body tissues also of people aged 60 and up are less sensitive to radiation's effect. On the other hand, as children, we are very sensitive to radiation's effect. And many children get repeated dental x-rays as well as other x-rays. So a history of the amount of radiation that a person has been subjected to, again, is a very good idea. No one should have a procedure that he or she does not need, they conclude. A CT scan can be life-saving if it provides your doctor with meaningful information. But if it doesn't, then you have a right to just say no to any test that doesn't really help. And these 8 questions should help you decide whether or not that helps. The University of California in Berkeley, in their wellness letter, headlines, "Do you really need a colonoscopy? Other tests are just as good." Why, they say, are a third to a half Americans not getting colonoscopies? Well, it's because people have some difficulty with the test as a whole. And because colonoscopies have become the most frequently used screening test, doctors tend not to even discuss alternatives with their patients. But if your doctor offers you only a colonoscopy and you don't want one for any reasons, perhaps you dread the bowel cleansing prep, perhaps you're scared or embarrassed about the procedure yourself, perhaps you worry about potential complications, or perhaps your insurance won't cover the rather high price, all right, then you certainly would deserve to hear about alternatives. You should know your other screening options. We think that more screening for colorectal cancer will be carried out if the American public is not made to feel that other screening tests than colonoscopies are somehow inferior, says Dr. James Ellison, Professor Emeritus of Medicine at the University of California, San Francisco, and a leading expert on colorectal cancer screening. Studies have found that colonoscopies don't save more lives than sigmoidoscopies, which examine only the lower part of the colon. When a sigmoidoscopy is combined with a stool test, then the results are very good indeed. Of course, the sigmoidoscopy does not look at the entire colon, but the polyps and cancers in the side that's hard to get to are usually very difficult to identify and incredibly difficult to remove. And the prep work doesn't really work as well on that far right side anyhow. So if a little seems easier to you than the whole thing, and it certainly would to me, then rest assured, it really is better than nothing. Colonoscopies can have factors that reduce their accuracy. They are less accurate if they're done quickly. They're less accurate if it's done by a less experienced doctor. And it is less accurate if the person has not completely cleared the colon. In addition, though colorectal cancer starts in certain polyps and so on, the vast majority of polyps that are detected and removed are completely harmless. It's estimated that 30 to 50% of Americans over 50 will have a polyp, and that only about 1% of those polyps will progress to cancer over a 10-year period. Colonoscopy poses a small but not insignificant risk of serious complications, including bleeding and colon perforation. Sigmoidoscopy has some real advantages over colonoscopy. It costs only a fraction as much. It's quicker. It can be done well by anybody, even a primary care doctor. The prep is a lot simpler. Sedation is not needed. And if something suspicious is found, you'll need a colonoscopy to remove it. But maybe it's not so necessary to remove it. Not so long ago, they go on, annual stool tests were the primary way to screen for colorectal cancer in the United States, and in most countries, they still are. This is called fecal occult blood test, and they detect hidden blood in the stool, which is a possible sign of colorectal cancer. It's pretty easy to do, and I've actually done the test, and then my doctor freaked out and said, oh my gosh, you've tested positive. And I said, well, remember that I told you before that I probably would test positive on this test because I know for a fact that I had, although it's painless and causes me no problem at all, I do know that I have an internal hemorrhoid, which does sometimes bleed, and that blood was probably in my stool. So I'm not worried about colon cancer, even though my fecal occult blood test found some occult blood. The wrap-up advice that they say is figure out a way to get screened for colorectal cancer because this screening is really saving people's lives. But colonoscopy is not the only test, and that's good because there really aren't enough skilled practitioners to screen everybody, and colonoscopy is not necessarily the best test. Think about sigmoidoscopy, think about an annual stool test, and also think about swallowing a camera. I'm not kidding you. There is now a tiny camera in a capsule, and you swallow it, and it goes through your gut. And so we do it from the end we're used to, the mouth end, and not the other end. There is still some prep involved, as we do need a clean surface to look at, but lots of different things. I'll be back next week to continue to talk about screening tests. And is your doctor scamming you with these tests? It's an interesting question. Thanks so much for being here, Gemini. I really appreciate you.
And we appreciate you, Susan, here at Time Monk Radio. And thanks again for a very interesting week of information. And this concludes part 82 of our series, The 7 Medicines the Wise Woman Way, with Susan Weed at Time Monk Radio.